The three principles of exercise. Exercise and activity are important aspects of human existence. Research in the medical and allied fields continually verifies beneficial aspects of maintaining cardiorespiratory and muscular fitness. For some people, knowing this is motivation enough to keep their activity levels high, while others are motivated only sporadically. Regardless of the motivation level, however, most people have difficulty knowing the quantity and intensity of activity that will enable them to live a healthy life and to engage in activities that can enhance that life. So, how much exercise do you need? Before discussing the three principles of exercise, let me give you a few thoughts on determining the amount of exercise you require. There is a minimum level of strength, endurance, flexibility, etc. that is needed for an individual to exist and to perform those chores and activities that enable them to be independent and to enjoy life. This minimum level is different for each person and difficult to quantify. One way to recognize it is by determining if you are able to perform those daily chores that enable you to live independently. Sleep, eat, dress yourself, perform necessary household chores. If you're able to do these things, we then must ask the question of whether or not you have additional energy or strength left over to do anything else that would contribute to a standard of activity or living that satisfies your needs for enjoying life. Of course, there is a possibility that disease or abnormalities affect your existence. Some of these, of course, are not amenable to help through exercise or activities, but others are. Therefore, the answer to how much exercise or activity you need requires you to determine where you are in relation to what you want out of life and how your level of fitness interacts with that determination. Once this is done, and you're interested in assessing possible activity regimens, you need to be able to evaluate your current activities, the activities you want to engage in, and the activities suggested by others. This is where the three principles of exercise come in. People are more likely to recognize and maintain appropriate fitness levels if they understand the underlying principles of how activity or exercise affects the human body. The following discussion is an attempt at providing a simplified set of concepts by which you can evaluate exercise or training. It is presented in three parts, the three principles of exercise. Simply stated, the three principles are use and disuse, overload, and specificity. These principles function at the cellular level, and since cells make up the main tissues and organs of the body, they apply to the muscles, the heart, which is a special muscle, the lungs, blood vessels, the bones, etc. The first principle is entitled Use and Disuse. Use and disuse is based on the biological principle that cells, tissues, and organs that are used maintain their ability to function, while cells that are not used deteriorate or atrophy, which means that their ability to function decreases. A common expression describing this principle is use it or lose it. For example, muscle cells provide the motive force in the body. We generally talk of three qualities: strength, endurance, and flexibility. Use of the muscles at current levels of strength, endurance, and flexibility maintains that level of strength, endurance, and flexibility. Disuse allows the muscles to weaken, have less endurance, lose flexibility, or combinations of all three qualities. Bone cells give structure to the body to withstand the forces of gravity and provide a lever system that allows the muscles to produce meaningful movement. Use maintains the density and therefore strength of bones. Disuse produces a decrease in the density or strength and makes them more susceptible to fracture. Fat cells function to store energy in the body for future use. Use of these cells involves the provision of adequate nourishment to enable them to maintain their size and storage capacity. Disuse occurs when nourishment is inadequate to support the energy needs of the body. This causes the fat cells to give up some of their content, thereby reducing their size. Note that the effect on fat cells initially seems to run contrary to the effect on muscle and bones, since in those tissues greater content or size is usually considered better, while in our culture more fat is not. The second principle of exercise is overload. This principle states that you need to use cells at a greater rate, intensity, or stress level than usual to stimulate an increase in their ability to function. It is during recuperation from this greater effort that the body will overcompensate slightly, thereby increasing the cell's ability to function. You should also be aware that there are limits to the degree above present level that you can stress tissues without injuring them. For muscle tissue, properly applied overload results in greater strength, endurance, and/or flexibility. For bone, overload causes it to take up more minerals, thereby increasing its density and strength. For fat, overload can be taken as providing excess nourishment. This will result in increased size or content of the cells, and in some cases has been shown to increase the number of cells. Once again, you should be aware that there are limits to the amount of overload. To a degree, the greater the overload, the greater the overcompensation, and the faster you might increase the quality you are working with. However, as the degree of overload increases, so does the discomfort from the exertion, and there is greater possibility of injury to the tissues involved. The common expression regarding this principle is no pain, no gain. However, properly applied, overload can produce gain without pain. It just takes a little longer. To emphasize this last point, for most people who have gained weight, lost strength, flexibility, or endurance, it has happened over an extended period of time, not overnight or within a few weeks. It should make sense then that regaining that strength, endurance, or losing that weight will also take an extended period of time. Recognizing this will help you to set goals that will allow the time and therefore reasonable overload levels to keep you on your program and will avoid unnecessary discomfort. The third principle of exercise is specificity. Cells, muscle, bone, etc. all respond only to the way in which they are used. In other words, results will be specific to what is being asked or required. This is closely related to the principle of use and disuse, but is separated to emphasize the need to analyze your activity in relation to what you intend to gain or what you might lose. You will only benefit in relation to the degree of similarity between training and the desired function or activity that is being performed. This is true for all the tissues we've been talking about, as well as their qualities, such as strength, endurance, flexibility, energy use, force, power, fat storage, skill, etc. For example, lifting heavy weights slowly will mainly increase the strength of the involved muscles, but will produce less of an effect on the muscle's endurance, ability to generate power, and may even decrease the flexibility if the exercise did not take the muscle through its full range of movement. Jogging will increase one's cardiorespiratory endurance and the endurance of the muscles being used, but will do little to increase the strength of those muscles, and again can reduce flexibility if the movement is only in a restricted range. Flexibility exercises will increase the extensibility of the muscle tissue and the range of motion at the exercise joints, but will do little for strength, endurance, power, etc. Although we have not mentioned it before, The nervous system also adheres to these principles. It is best seen in the development of skill. When you begin a new skill pattern, such as dribbling a basketball, the ball tends to bounce erratically, and you have to watch it carefully to be sure your hand moves appropriately to be over the ball for the next bounce. As you practice, the nerve connections become better acquainted with the feel, force needed, and positioning required for dribbling, and soon you find that you no longer have to look at the ball as much to know where to place your hand for the next bounce. When this movement pattern becomes well established, you find that you no longer look at the ball and can concentrate entirely on what other players are doing and where you want to go. Now, to cite an extreme example, learning the pattern of nervous connections for dribbling does little to increase your skill for hitting a tennis ball. These two skills have little commonality and therefore tend to be specific to the practice. A second example concerning the nervous system involves learning how to add, subtract, multiply, etc. in your head. You did this in grade school and probably became quite proficient at it when learning your times tables. Later in life, with calculators, computers, scanners available in stores and at work, there is little need to use these once learned skills. When the power goes out and you're forced to do some calculations in your head, it takes a little while to figure it out, if you're able to do it at all. Well, that's it. A brief explanation of the three principles of exercise. Remember, these principles apply to all the tissues involved in exercise: bone, muscle, fat, nerve, etc. The better you understand them, the easier it will be to predict or evaluate the effect of an exercise program or sedentary living on the human body.